Hi,
Hi, good
how are
morning.
you? Good morning. I was just telling everybody how excited I am to have this conversation with you. And let me quickly do an introduction because you are incredible. So, Dr. Shahin Ghadir is one of LA's top fertility and infertility doctors. He works at the Southern California Reproduction Center. And yeah, you have such an incredible Instagram and YouTube channel where you're just providing so much great and free information to families to help them get the children and reproduction journeys the way that they desire. So, so excited to have you on.
Thank you.
And yeah,
Thank
so
you very much. I'm really excited to be here. And it's lovely to do this with, I think, people that I really believe in what they're doing as well. So it's an honor to be here. Thank you so much.
thank you for coming. So we had so many questions, and I think I wanted just to start with kind of fertility 101 because some of the moms or women who are watching this are about to start their reproductive journey, let's call it. And I know when I was just thinking about getting pregnant with my husband, this is now 4 years ago. I was really worried because so many of my friends were having challenges and it was taking longer. And I just wanted to hear from your side. What are you seeing? What should we know? And I'll let you take it away.
Thank you so much. So, I've been with SCRC for 18 years and working here as a physician after fellowship for the last 15 years. And as one of the partners here, I can tell you that the world of fertility has changed significantly. We were seeing patients that had been trying for years and years and then coming in for services when I had just gotten started. And now it's become completely different. We have an entire division of people coming in because they're trying to be safe for their future. So anyone that's trying to do cryopreservation or freezing their eggs, we have even guys coming in for freezing their sperm. Thinking about the future. We have patients that are becoming more proactive. They're not waiting a year before they come and see us. We have couples that are coming in because they're like, you know what, I'm in my 30s and we think we want to have 3 or 4 kids. Why not get smart about what we can do right now? So the realm of what we're doing now has grown significantly. All of it to protect people, all of it to help people. Our success rates have gone up significantly. We right now have hit the 80 percentile. So we have our successes vary between 76 to 84%. That's what it was for all of 2019. We're very, very proud of our IVF lab. But we are seeing people that are very interested in becoming much more proactive than they've been in the past. And we love that. So
Yeah.
we're doing something right that people are learning about this, but we're still not quite there.
Yeah. Yeah. No, I mean, I remember when I was thinking about getting pregnant, I just assumed that I needed to get, 3, 4 months in advance, start doing acupuncture and all those things. And I think there's so much knowledge and information, some of it that you're putting out into the world where people are really getting informed and understanding that it may take a little bit longer. And so that's awesome. So tell us about like what are you seeing in the world of, let's say, Los Angeles? Because you're here in Los Angeles, Beverly Hills. I guess what's the most common challenge that women have on their journey, and what are you doing to
So
help them?
right now, what we're noticing during this unfortunate pandemic is that people are sitting at home thinking smart things about their future. And
Mm,
what are they going to do? It's giving people the opportunity to reset and to kind of figure out what they're doing moving forward. I'm doing phone calls and telemedicine calls all day long, more
yeah.
than I have ever. And to be honest, the first couple of weeks were very quiet and not doing much. But now I'm completely busy from the beginning of the day to the end of the day. And it's not just limited what I'm doing to Los Angeles. So I'm doing calls with people around the world about talking about their fertility, giving second opinions. We've always had people come from all over the world to our practice.
Yeah.
Um, we have a large group of people coming from Australia, from Europe, a huge amount from China that's completely on hold right now. So we're doing these consultations around the world, kind of getting people aware of what to do now and also what to do for the future and where we are in this process. Just to let everyone know that right now in this process, our clinic has decided to allow a small group of people to come through. people that cannot wait 6 months or a year, and it may destroy their fertility if they did. But we're allowing a small number of patients come through. We're also giving advice on what to do right now. We're still in a very safe manner able to bring in people to do the testing that they need to do right now and figure out exactly what's going on and what they need to do. So we're being as proactive as we can to help as many people as we can.
Amazing. And what are things that, what would be cases that couldn't wait, for example?
So if you're over the age of 35 with a decline level of fertility, we are letting those people, we have a committee here at the practice that assesses everyone's case, looking at your blood tests that tell you how fertile you are, your ultrasound results, your age, your previous, how long you've been trying, what you've done and what you've failed and what you've done well. And those are the things that are allowing us to decide the order that we're bringing people in. If you're 26 years old and you have 3 girls at home and you really want to go for that boy, right now you may not get to the front of the line. But we're really being very proactive in allowing people that we think need to, because we're spacing patients out. We are not bringing as many people in. We're limiting the number of our own employees here. We have an entire protocol of how you come into the clinic with temperature checks, paperwork that you have to fill out, and the timing of how people are coming in and how spread out they are, to be extra safe for everyone's case.
Yeah. So I'm just going to ask a couple of questions that we have here. What are some lifestyle changes that may boost fertility? If somebody is, let's say, is at home right now, which everybody is, what's something that let's say the most important thing that you think would be helpful for her?
I think right now the most important thing for those patients that are not at their ideal weight, making sure that they can take advantage of being as healthy as possible and trying to get to your ideal weight. Weight has so much bearing on fertility, and so many people ignore that. So trying to get into the best shape that you've ever been. I have never seen as many people running and jogging and walking in my neighborhood that I see now. Never, including myself. So I wasn't a big jogger, and now I'm jogging, and I'm like beginning to notice how amazing the streets are and the trees are and everything else that I never even noticed. So I think that being very careful at home and trying to eat home-cooked meals that are healthy, not so much restaurant and fast food that people are kind of avoiding these days. I think taking advantage and being as healthy as you can right now is the #1 thing that anyone can do for themselves.
That's awesome. Yeah. So, and how would somebody determine their ideal weight, right? Is that something that
yes,
is
you can actually go onto the Google BMI, body mass index, and you can put in your weight and your height, and it'll tell you what you need to be to calculate the BMI that's usually between 20 and 25, which is considered to be normal.
Interesting. Okay.
But if you're not in an ideal position, if you were to get advice from a fertility specialist, there are medications that we give people with polycystic ovarian syndrome. There are supplements that we give people to try to boost their fertility and to keep things going on well. There are antioxidants that we provide to people that want to hold on to things to the best that they can as well.
Cool. I love that. So if you're at home right now, which again you are, like it's time to walk, eat well, and take fresh air and lower your stress so you can get pregnant quicker. I like that. How long does it take typically for an average woman to get pregnant when faced with fertility challenges?
So that answer really depends. So if it's a patient that, for example, has blocked fallopian tubes, she's never going to get pregnant on her own. But if she were to do IVF and to make beautiful embryos and to do an embryo transfer back into the uterus, usually within 2 to 3 months of starting, she could be pregnant. If it's someone else that's choosing to go to a different path like artificial insemination, right now, all of the reputable clinics in the country know not to get people actively pregnant. So artificial insemination, ovulation induction, frozen embryo transfers, those have all been put on hold right now for good reason. We don't know what the implications of COVID on someone who is pregnant are going to mean in the long term. And for that reason, we're telling people to kind of just take it easy and try to make embryos, do everything you can. But right now, actively trying to get pregnant from the perspective of a fertility specialist is a little bit scary, not knowing what could happen.
Yeah, I think that's really interesting. We had a Dr. Burzin on yesterday who was talking about we just don't have enough information right now, right? And I hear all day I hear all day long, like, there's nothing wrong with pregnant women getting COVID. And I see all these photos of pregnant nurses who, God bless them, are doing their jobs. And I'm nervous for them because I personally know the effects of viruses. And I'm pretty sure that some of my autoimmune challenges have been due to certain viruses that I've gotten in the past. So I think it's really important to note that we really don't know the effects of COVID, right?
No, you
Long
don't.
term.
But that's a perfect example. If you do have autoimmune issues, that's a perfect example of someone that could be doing things now, hand in hand with their rheumatologist and their fertility specialist, to make sure that they're addressing those things. So when the time comes to be pregnant, your body is ready and you're not in the middle of a flare-up of an autoimmune issue.
No, that's really great news, right? Okay, so when should somebody come see you? I think you kind of answered that, but like being proactive, like seeing you before somebody wants to get pregnant, that's kind of when they should start seeing you?
So the guidelines of the diagnosis of fertility, they vary. So if you're under the age of 35, to get diagnosed with infertility, you have to have been trying for 1 year actively. And if it doesn't work, then you're diagnosed with infertility. If you're over the age of 35, the guideline is over 6 months. In my opinion, if you are 32 years old and have very irregular periods, there's no purpose to wait 1 year. There's a reason you're not getting pregnant, and that could be basically the ovulation. If you want to be more proactive and make sure that your fallopian tubes, for example, are open with a special test that we do in the clinic, and make sure things are fine, or just to learn where your status is in terms of how fertile you are, I think you have nothing to lose by doing those things a little earlier.
Yeah. That brings me to a really interesting point, right? Like, I knew I went into pregnancy thinking that I was going to have challenges, and I'm super proactive in everything. Like, I researched like nobody's business. But how does one, like, outside of their period, right? Like, until I was the age of 32, I didn't know anything about my body as far as ovulation. And how does, like, what would one do to get knowledgeable about where her body is at? Are there apps out there that you would recommend? Are there books?
So there are apps out there, but you got to be very careful. So I have a lot of patients of mine that tell me, oh, I just do the app, and when it tells me I'm ovulating, I have intercourse. But the app has been made for the person with the perfect menstrual cycle, not for you. Right. So I recommend for you to do ovulation predictor kits when you pee on the stick to see when it's turning on. There's always one line on, but when the second line is on, that means that your LH spike, it's a hormone that spikes before ovulation occurs within about 12 to 24 hours. So if you're doing the ovulation predictor kits in the morning and it turns positive, you know that that night and maximum 2 more nights after that is basically your entire ovulation window. And for those 3 nights in a row, if you can, you have intercourse. And if you can't every day, you do it every other day. So that's the best way to do it in terms of being proactive. The apps are good at teaching you and keeping track of things. So you have an idea, oh, for the last year, my periods weren't as regular as I thought. They actually vary, and I actually missed a month. So those are reasons why the apps are helpful, but they're not going to tell you specifics about yourself. So keeping track of your menstrual cycle, the number of days you bleed, and how ovulation is, along with the symptoms of ovulation, like clear vaginal discharge and crampiness, is really smart thing to do proactively if you're not ready to go straight into something at a doctor's office.
Yeah, I got a little crazy. I got that book, Taking Charge of Your Fertility. I'm sure you know of it. I think and I was literally checking my cervix. I was checking like everything, but until I got that book and was thinking about pregnancy, I was surprised at my limited knowledge of my body, and it was pretty incredible. I mean, I knew that I had fallopian tubes and my ovaries and all those things and my parts, and I knew where they were, but I didn't know that getting pregnant also meant knowing how not to get pregnant, right? And that was a big deal for me as well. And so if you guys are listening, like, get knowledgeable about your body, right? And I think that would probably also boost a little bit of, you know, I have a friend, and she told me she was trying to get pregnant, and I said, you know, I asked some probably random questions about, you know, well, do you have any discharge? Or, you know, when you're ovulating, you know, your discharge turns pretty clear, and it allows the sperm to go through really fast because it's slippery, and she had no idea what I was talking about. And so do you think it's helpful for women to, I mean, I know it's helpful, right? Like to have women learn about their
Absolutely. I
bodies.
think it's beyond important to be aware of what's going on with your body. You should understand what goes on. And for some people, doing all of the checks that you're saying could be overwhelming and very
Yeah.
stressful.
Yeah.
And then for other people, it's very educating and they feel in control once they've learned to do so. So I'm one that likes to know more and do more. And the more I learn and the more I do kind of calms me down. So if you're one of those people, I would definitely do that. I think it's a very good time to grab a book. I think it's a great time to do a consultation on the phone for an hour with a doctor that can educate you and teach you. I think it's really important to be able to have someone as a resource. And that's something that I really go out of my way. For example, when I'm doing a consultation with someone, I just talk like I'm talking right now with you. And I think it really goes a long way trying to teach someone what's going on. I have, during my training years, I've worked with a lot of other doctors. And I was thinking, like I would be in a room doing with a consultation. I'm like, the patient is not getting what you're saying right now. And it's really important to be able to talk in a way that someone understands, and also understand some people do not want to know everything and some people want to know everything. And it's really important to understand who your audience is and to be able to do so. And for ourselves at home trying to figure this out, I think it's really important to know, am I the one that needs to go get 3 books right now to understand and I'll feel calm once I've read them? Or am I the kind of person that needs someone to control this for me and tell me what to do? Right. So I think understanding that and being able to take that proactive first step is really smart.
So know who you are and then act accordingly. I love it.
Exactly. Make sure
I have like
if you're getting support. Yeah. If you're going to have support from someone in this process, make sure that it's someone that's on the same page as you, that knows what your goals are.
Yeah. And so you take consultations right now. People can book that through your website, and you can do it from anywhere in the world, right? Somebody from Italy who might be watching this could schedule a time with you.
I actually did a consultation yesterday with a patient in Italy. So yes, we do. We do consultations with people around the world. There's multiple ways of doing it. You can go to our website, which is scrcivf.com. I have people even sending me messages. If they send me their full name, date of birth, email address, phone number, I'll forward it to our new patient coordinator, who will reach out by email or call the patient and help schedule. But yes, we are doing telemedicine to help people out there because we are completely aware that unfortunately, the financial implications of COVID have been huge on the world. We have reduced by 1/3 the price of our consultation to help people and get them organized. It's not going to last forever, but for right now it is, and we're able to do so. We're on the phone giving constructive ideas for people of what to do, and also reassessing what they've done in the past and giving our point of views on what we think was done correctly and what's not. And there are people that are saying, listen, I'm just going to wait till this is done and we're going to come and see you in LA. So make a nice little vacation / fertility treatment episode from it. So we're able to do that. And we've done that in the past for many, many people.
Great. And then we'll include that in our email. This video will go also on our email. So if anybody is interested, we'll include that information so you can get in contact with them directly as well. So let's say, so first of all, I need to talk about that word infertility. I don't know why it's so triggering for me. Like infertile just feels like you're blaming a woman for her body's, challenges, let's call it. Are there better positive, I'm one of those, like, let's do everything positive. And
so I like to use the word fertility.
Yeah.
Not the word infertility.
Infertility, yeah.
Because when you're coming to see me, you're not coming to become infertile. You're coming to be fertile.
Yes.
So I call myself a fertility specialist, and on my YouTube channel, it's called the Fertility Expert. So there's a lot of things that we do proactive. If you're going to be seeing me, you're going to be positive.
Yeah.
I pull patients aside all the time, and I have a patient of mine that has been going through a long journey to get pregnant. She's pregnant, and she comes in once a week for her routine checkups. She's masked and gloved, and we stay far away from each other while the technician does an ultrasound. But she was saying, I said, you're now pregnant, and instead of enjoying the moment, you're now thinking about a million other things that are going to happen to you, and I need you to stop right now. Because it's not fair to you, and it's not fair to your growing baby inside of you to have this negativity going through to you. And she finally said to me, you're absolutely right. I'm finally where I want to be, and I need to learn how to enjoy it. You know, I think it's, with everything else that's going on right now, I think it's incredibly important. And I had a friend tell me this like a week and a half ago, and it really resonated. Try to see the silver lining in things right now. You know, I felt like I was spread so thin before this entire pandemic, and now I'm catching up on life.
Yeah.
I'm learning to enjoy the things. I'm learning to enjoy my kids. I'm learning to enjoy my home, my neighborhood, just the little things that I was just ignoring. And to be honest, I'm getting, in some ways, there's many things that I'm really beginning to enjoy about this slower pace of life, that I don't think I'm going to go straight back to my old life, even if tomorrow they said it's over and you can do whatever you want to do.
I hear that from everybody. I mean, I literally didn't think I could fit one more thing into my day before the pandemic. And now I just feel like I'm more graceful in everything that I touch. You know, I'm more present with my kids. I'm more present with my body. And I'm hopeful that this pandemic is going to help more women get pregnant, because hopefully women are slowing down. I mean, I keep reading about infertility on our Instagram page, and you know, people talk about it being a second-time job or a full-time job. And so, you know, it might be interesting to see how that changes, right? If we stop, go inward, and see what's happening with our bodies, and take the time to focus on health and, you know, body weight and all those things that you mentioned that are helpful to getting pregnant, how that might increase our chances of getting pregnant as well. So,
by the way, you said something that I wanted to comment on right now.
Yes.
If you feel that infertility is becoming a full-time job for you, you need to seek professional opinion and help from a fertility specialist that's going to take some of that weight off of you and tell you what you're doing. It shouldn't, like when people tell me they do basal body temperatures and every single morning, the second they wake up, they're checking that, I tell them to stop. Because the last thing you want to do is every single morning when you wake up, the first thing you do is remind yourself of your fertility challenges.
Yeah. So
you can do one simple blood test around day 21, 22, or 23. It's a progesterone test that tells you if you ovulated. You don't need to do things like that. So the right person involved in this process for you, or in this journey for you, that's going to hold your hand and take you through it, is going to be the perfect person to help you navigate so it's not becoming a full-time job. I've had to do IVF myself with my wife. I have beautiful twins as a result of it. And I have two other kids. One is surprise and one that was super easy early on. But I know what it's like to go through this process. It is not fun. But doing it in the right way, in the right clinic that is good, because unfortunately I see this all the time. There are a lot of clinics that are not that good and doing a lot of things and causing more problems for patients. You got to make sure you're doing this the right way. That's going to give you the calm and confidence in who's helping you to be able to guide you through this process.
Yeah, that makes sense, right? It's like having a good partner in marriage, right? So I have another question here. Let's see. I can't pronounce her name. I think it's Sigoli. Can you please talk about fertility and being HPV positive?
So there are really, if you're HPV positive, but no risk of active cervical cancer, there's really no risk of HPV on fertility at all. At all. It's just as simple as that. You need to follow up with your doctor with the recommendations that are generally every 6 months until HPV clears. Do everything you can to increase your body's self-immunity, because that's going to be getting rid of the HPV. Nothing else will. And once that's out of your system, you're able to proceed. There are many women that have HPV positive that are pregnant, and it should not be affecting fertility in any way.
So when you said boosting immunity, what's one example a woman could boost her immunity?
I'm a huge proponent of using antioxidants. CoQ10, which is CoQ10, we give the purest form of it called ubiquinol, and taking 600 milligrams of CoQ10 a day really reduces all of the antioxidant effects of the body, and I think is fantastic for immunity. Increasing antioxidants in a very natural way, blueberries, greens, healthy foods. It's a perfect time when you're at home right now to be able to take good care of your body. And something that's really important and has really been forgotten is sleep. Sleep is so important for everything, including your immunity. And I want people to take advantage of this time. If you can, get good sleep in. Yeah,
it's amazing. I take, I always call it CoQ10, but CoQ10 just for my autoimmune stuff, and sleep and that have really, I feel like I wake up feeling so much better in general. All right. Is there anything else that you want to talk about that you think is important for women on the fertility journey?
I think that your questions have been amazing. I really appreciate websites and Instagram pages like yours that really support women. I think being involved, I think having the right support system for women is really important. If you're single and considering doing egg freezing, find a friend that's in the similar shoes as you and do it with that person. If I think completely closing off the world while you're struggling with issues of getting pregnant is a big mistake for many people. It isolates you, it makes you feel lonely, it doesn't let you have that support that human beings need in every single way. And having the appropriate support system, whether it's your doctor and the team at the doctor's office or at home, is really, really important.
I mean, if I was trying to have a baby right now, I would come to you and want you to be my support person, because I just feel like I could just hand you all of my stress and all of my anxiety to help me get pregnant. So thank you. It's amazing what you're doing, and I am so grateful for your time. And so again, everything here is going to be in our email. You can sign up for our email in our profile link. We will add Dr. Shahin's information there, and that contact information, and anything else that Dr. Shahin you want to give to us to add to the email blast, we will add.
Perfect. We're giving a lot of announcements these days. I've become much more proactive on my Instagram page. So if people want to follow along, we're letting them know of different Instagrams, lives that we're doing, about different events we're having, webinars that we're having. So it's a perfect way to stay tuned.
Yeah, and your YouTube is fabulous. I literally just kept watching videos about fertility, and it's pretty amazing, the information. So if you are trying to get pregnant and are interested in more information, go to Dr. Shahin's Instagram. He has a YouTube video. If you're in Beverly Hills, you can go to him once COVID's done, or once we're out of our, what is it called, our stay at home order. And also you're doing telemedicine, which is game changing, because I love it. I do telemedicine with my general practitioner at Parsley Health, and it's amazing. I mean, I've been doing it for now 2 years, because I kind of live out in the woods. And so it's just great. And you realize that you can have your blood taken anywhere, and the doctor can tell you what's going on with you. Yep. So take advantage of the most incredible time of our life, being able to be present with ourselves, and to have access to doctors like Dr. Shahin, who are there for you and will be your partner and hold your hand and help get you the support that you need in your pregnancy fertility journey. And anybody who is watching who is having challenges or feel like they're not getting the results fast enough, just know that it is possible. It may not look the way that you desire. It may look different, or it may look exactly, just with a little bit of different road, with different roads. And so we love you, and we hope everyone is doing well. And Dr. Shahin, thank you so much.
Thank you so much.
I hope we can have you on again. And yeah, thank you.
Thank you very much. Have a wonderful day, everyone, and stay safe.
Thanks, you too.